Vice has some good news for weed smokers. They report, quote, "The results from the first and longest study ever conducted on medical cannabis use for chronic pain management are finally in, and medical pot is safe to use." Shocker. The study was conducted by researchers at McGill University in Montreal and followed 215 experienced smokers as they toked up 2.5 grams a day, as well as 216 non-smokers for 4 years, between 2004 and 2008, with a follow-up after 1 year. The participants, who all suffered from a wide range of chronic pains, were tested for lung function, underwent blood tests, and had cognitive abilities like memory examined. All adverse effects, from mild headaches to serious disorders, were reported by subjects. In a paper describing the results of the study, published Tuesday in the Journal of Pain, the researchers write that cannabis users reported less pain, better overall moods, and had no increased risk of serious adverse effects compared to the control group. Now, they go on to explain that there were minor inconveniences, you could say, like some respiratory issues because they're smoking, but that can be remedied by using the vaporizer as opposed to smoking it like most people would smoke weed. So there's an answer to that, and then they say other minor things like some people would get dizzy every now and then, but overall, the quality of life of the people who were smoking weed to deal with chronic pain versus the people who weren't, it was much better for the people who were. So the takeaway from this is, now you could say, hey, it needs a little bit more study. Maybe, maybe not. I'm kind of convinced already, but even if we do more study, I think the main takeaway is going to be, if we were so inclined, it would make sense for marijuana, for some patients, to be used for chronic pain in the same way that one would use Vicodin or Percocet or other opiates for it. Now, I'm not your typical leftist who loves to bash opiate drugs because they're made by the evil pharmaceutical companies, so therefore they must be bad. I'm not that guy. I think opiates have helped many people. Sure, some people get addicted, they overdose, and there's problems with it, no doubt. But I think the overwhelming majority of people who use it either to treat pain or they can use it recreationally as a drug, and it's fine. So I'm not going to bash it, but I do think people should have the fucking option. There are some people who, they react poorly to opiates, and that's a fact of reality, so they should have the option. A guy like me would choose opiates over marijuana all day long, but other people would want marijuana over opiates, and why shouldn't they have that choice if both are going to relieve pain? So the main takeaway is, if you guys already didn't know, there are plenty of medical uses for marijuana, including treatment of chronic pain, as we see here. And to go a step further, which you all knew I was going to do, it should also be legal just for recreational use, because radicals like me actually believe in this thing called, what is it again? Oh yeah, freedom.